All right, everybody, welcome back to Twin Cities Live. We are so glad that you're here while Ben and Elizabeth are in Ireland. We have not forgotten that September is Ovarian Cancer Awareness Month. It is a dedicated time every year to remind people to learn about the signs, the symptoms, and the risk of developing this disease.
There's one symptom that our reporter, Kelli Hansen, had never heard of until she met Joan, a grandmother. She's a published author, and she's an ovarian cancer thriver. As we thrive with Twin Cities Live, Kelli met her oncologist at Minnesota Oncology to learn more about this silent cancer.
I'm glad you're doing okay on the treatment, though.
Yeah, it's going well.
Yeah, I know we're just one in, but we'll get another scan after the third cycle and see how things are looking.
A visit with Minnesota Oncology oncologist Dr. Lori Weinberg has become routine for this 92-year-old. That's because 2 years ago, Joanne Reisberg was diagnosed with ovarian cancer.
Surgery, chemotherapy in your 90s.
Right.
Did you think you were ready for this?
I didn't have any choice. I can think, I can read, I can walk, I can drive my car. So I thought, I'm very fortunate. So I didn't look at this as a downer, just as a challenge.
The most common age for women to get diagnosed with ovarian cancer is about age 55 to 65. So the vast majority are kind of in that age range. And then, of course, 65 to 75. But 84 and up, only 7% of women with ovarian cancer are diagnosed at that age range. And not every woman over 84 is going to be a great candidate for surgery and chemotherapy, right? But some women are.
My mother she's a go-getter. She's very spunky, and we discussed it because she didn't have to do it. And Dr. Weinberg, laid out all the options for her, which was great. And, my mom just said, I have things to do. So she went through the 3 rounds of chemo, and then about a month after that, she had the surgery, and then 3 more rounds of chemo. And she tolerated it all really well, and yeah, she's still with us here now, and so she's doing great.
Dr. Weinberg says Joanne is proving that when it comes to a cancer diagnosis, age is just a number.
When we had a conversation when we first met about what our options would be if we were going to do chemotherapy or not, she was very realistic and understanding. At her age, is this something I could really do? But we explained that sometimes we tailor treatment to people who are older or may not be as strong, and we can kind of, do a little bit of trial and error. We don't always have to start, and finish the entire cycles. So Joanne was very flexible and understanding, and we kind of just went with it with each cycle at a time to make sure that she was going to do okay, and she did great. There's ups and downs to treatment as always, but she did absolutely wonderful and stayed so positive throughout her treatment.
Yeah. Ovarian cancer, I know, is silent in many ways, right?
Yes.
In talking about it, but also in detection.
The symptoms that women have for ovarian cancer when it does start to grow usually is feeling full and feeling some abdominal pain, sometimes indigestion, bloating, trying to eat and just getting full real fast. And these are symptoms that are common for many reasons, right? So it is often really hard to diagnose, and most of these symptoms that I'm talking about are symptoms when women have their cancer more advanced, stage 3 and stage 4. When it's early stage and there's just a mass on the ovary, often you don't feel anything at all, which is why it's really hard to detect these cancers when they're early on in stage 1 and 2.
She had mentioned to me that a couple of months before that, she had seen her doctor, and that her bra was kind of tight. It just didn't seem to be fitting well. She hadn't gained any weight or anything, and she didn't really mention it to her doctor. She didn't think anything of it. That was due to the bloating, which, of course, I'd never heard of that being a symptom of a cancer. I mean, I didn't know anything about cancer in general or ovarian cancer specifically. So Dr. Weinberg and her team have been fantastic, walking us through here what your options are. Here's what it's going to look like when you're going through chemo. Here's what it's going to look like when you're going through the surgery and after the surgery. They've been fantastic helping us through that. She can do everything she did 3 years ago. She still lives alone, and she's got 5 manuscripts in the works right now. She's a published author and still hangs out with her grandkids. We went apple picking at the lake a couple weeks ago and rode around on the pontoon boat, so she's doing great.
Okay. So I'm fortunate. Just never give up. Just keep going.
And that's what she's doing, not giving up.
Yeah.
She looks fantastic. So Dr. Weinberg also told Kelli that because ovarian cancer is so hard to detect, especially in its early stages, it's important you know your family history. There's some genetic testing that can look at a person's DNA for inherited mutations, and that may be something that would increase your risk of developing cancer. So having that information, it can really help doctors be more proactive.
It's so important. So listen, Minnesota Oncology, it is the Twin Cities' largest and only independent cancer provider. They got more than 100 experts in 13 different locations. You can learn more at twincitieslive.com.